Minnesota's drug overdose problem is getting worse. Today, the state health department announced the number of drug overdose deaths continues to rise. Last year, 637 Minnesotans died from a drug overdose. That's up from 583 in 2015, a 9% increase. More than half of those deaths were from opioid overdoses. Angela Davis shows us the new tool the health department has to combat the problem.
More people die from drug overdoses in Minnesota than from traffic accidents. The number of overdose deaths is nearly 6 times higher than it was in 2000. State leaders call it a public health crisis.
This means that on an average day, nearly 2 people died in Minnesota from drug overdose in 2016.
A majority of the 637 deaths were from opioid overdoses. Prescribed drugs like oxycodone accounted for the greatest number of those.
Prescription opioids are still the leading cause of opioid-involved deaths in Minnesota.
The most high-profile drug overdose death was that of Prince. He was one of 85 people in Minnesota who overdosed on fentanyl last year. So how did we get here?
First, Minnesotans believed that pain medicines were more safe than they really are. Second, there was an increased emphasis on preventing pain. Third, we did not really fully recognize how quickly we could become dependent upon pain medications.
The health department just launched a data dashboard that will consolidate information about overdose deaths, making it easier for law enforcement officers and medical professionals to track the problem and provide help to those in need.
Minnesotans are suffering from what we're calling diseases of despair, such as chronic pain, depression, and chemical dependency.
The latest numbers on drug overdose deaths in Minnesota also revealed some stark racial disparities. The state says American Indians were 6 times as likely to die from a drug overdose than whites. African Americans were twice as likely to die from an overdose than white Minnesotans. Health leaders also talked today a lot about a lack of hope. They see that as a leading cause, an underlying cause for drug use.
Yeah. All right. Thank you, Angela.